So, can we take? I'll just take it off. Hi guys, good morning.
بس قد ما المايك
We are Team Gold. Hey, okay, good. We are Team Gold Diggers from MS Pharma, and we have prepared a presentation for you to show you what we have done in regards to our initiative. Okay, so a little bit more about MS Pharma before we start with the presentation. احنا طبعا شركة أدوية. We are a pharmaceutical company. We are a leading pharmaceutical company. We have operations and we manufacture in all Meta. We have started in 1989. The first facility كانت United Pharmaceuticals بالأردن هون. كنا أول شركة that got the GMP certificate to start manufacturing and export to the European countries. And then in 2009, we established one of the biggest pharmaceutical manufacturing facility in Algeria. It's called Al Kindi. ب 2011 we acquired a facility here to start manufacturing injectables, so liquid vials and ampoules. ب 2013 we established the head office here in Jordan. ب 2016 we acquired another facility in Turkey just for the sake of expanding and covering more geographical markets. ب 2018 we established 3 facilities in Saudi Arabia. And آخر إشي, our key to enter the European market was through our acquisition of our affiliate Gene Farm. So because we are a pharmaceutical company, we chose goal number 3, which is basically, it's about health and well-being because it reflects where we come from. Most of us are pharmacists, and patient care and the safety and the health of the patient is our priority. So we shared our name. The name of the team is called Gold Diggers. We share passion for work, for each other, and for our society. Sorry. For the sake of this goal, because it's health and well-being, we have started doing a couple of initiatives. وعملنا كتير campaigns من وقت ما أخذنا هذا ال commitment toward health and well-being and to help the communities and the societies, especially the underserved communities here in Jordan. One of the biggest campaigns اللي عملناها كانت the best use of medicine, and I think Hiba here, one of the girls in the team, can share more with you what we did in regards to that.
Thank you, Lana. أنا هبة الحلو. I'm the medical advisor in the company. So زي ما Lana حكت, choosing the third goal, good health and well-being, we thought, how can we spread awareness about health issues and the use of medicine? So we came up with the Best Use of Medicine campaign, where we basically did over 30 awareness sessions to over 1,500 people. Of course, this was prior to pandemic lockdown, all of that. So we went into different institutions, people not from any healthcare backgrounds, and we've talked about issues of daily, let's say, use of medicine, storage, how to properly use the medicine, not to overuse it, underusing during pregnancy, during lactation. We were surprised by the number of questions about things because we came from a pharmaceutical background. We think everyone is well aware of these things. And we actually really made an impact on these people. They really had questions on how to properly use and store the medicine. So after the lockdown and all of that, we were unable to proceed with this. So we took this, just like everything else, from home or online. So we took the Best Use of Medicine awareness sessions or campaign to our online platforms, using our own people, delivering sessions of different topics to people and posting it every Friday on our platforms on LinkedIn. We also did internal awareness sessions to our own employees, because not all of our employees are also from a pharmaceutical or healthcare background. One of the other initiatives that we have also did as a team, Lana, please, next, was the virtual clinics. So during the lockdown, people were unable to reach their healthcare providers, the doctors. زي ما بتعرفوا الدكاترة بشهر 3 و4 ما كانوا أو 5 كمان ما كانوا بيقدروا يروحوا على العيادات، والمرضى ما قدروا يشوفوا الدكاترة. فاللي عملناه تواصلنا مع الدكاترة وطرحنا فكرة إذا بيقدروا يعملوا زي يوم صحي مفتوح لكل المرضى basically. ونشرنا طبعا اعلنا عن هذا الايفنت، وفي كثير ناس joined in. عملنا سيشن ل different specialties زي الجلسه حواريه في الامراض النفسيه. الناس they begged us بالاخر انه بدنا اكثر، بدنا نسال اكثر، بدنا نتواصل مع الدكاتره. عملنا ايفنتس على الاردن، على دول الخليج، بالجزائر، بالعراق. يعني كان سهل طبعا هذا الاشي انه اونلاين نعمل الايفنتس هاي بكذا دوله. كمان عملنا سيشن طبعا عن الكوفيد وعلى موضوع الصحه التنفسيه. كان وقتها برضه بوقت رمضان عملنا برضه يوم مفتوح للتوعيه خلال شهر رمضان مع الكوفيد، مع السكري، مع كل هاي القصص. Thank you.
So يعني we did other stuff وقت الكورونا لما كانت complete lockdown. We weren't able to leave our homes and houses. طبعا it affected all of us. It was a pandemic. It was unexpected. كلنا انحبسنا بالبيت for like months, and we did not know when this is gonna end. So we decided to collaborate with Salah Amaira to and he gave us a session on how to take care of our mental health. We had to focus on our mental health and how to stay positive in terms of the things that we can do mentally or like physically. يعني ايش مثلا كان بيعطينا افكار نعمل let's مثلا انه let's work out، اعملوا هيك meditate كل يوم نص ساعة before like you start your day. It will help you. فبعدين قلنا okay then let's do a yoga session with Salah Amaira, and actually so many people from the company joined for the yoga session. It was nice. We meditated for like an hour to هيك refresh and recharge with positive energy. كمان one of the big things that we did in collaboration with our strategic partner in Jazz was the school sanitation. So at the beginning لما بلشت المدارس ترجع the situation was starting to get better, we were able to sanitize around 13 public schools in Sahab area. And the project was still ongoing, but then unfortunately the schools went on shutdown, so we had to we stopped the project for the time being, but we will continue at least maybe next year if the schools will go back. طبعا with everything that we did, our awareness posts on all of our social media platforms did not stop. We did so many posts depending on, for example إذا كان breast cancer month كنا بننزل post على breast cancer, autism, insomnia, world health day. يعني البوستس كانت بتنزل on weekly basis to give tips or about the disease, not necessarily tips on how to prevent the disease. Not only posts, كمان عملنا videos. So it was not only posts, كمان on weekly basis كنا بننزل sometimes videos when it is needed. على مثلا نزلنا على hepatitis virus on the World Hepatitis Day. These are just examples. وعلى على World Blood Day كمان وقت World Blood Donor Date وتبرعنا وقتها اجت KHCC وتسحبوا منا دم in order to help. That is one of the good things that we did also. هلا بعد ما الكورونا خلصت يعني مش خلصت خفت شوي, we were able to طبعا taking all the precautionary measures and the safety measures, we were able to physically reach out to well-known doctors in Jordan, not necessarily مثلا reaching out to them, كنا بنحكي معاهم and we asked them to give us tips. يعني مثلا دكتور محمد أعطانا tips على arthritis. عندنا different doctors from different specialties. أنا مش كتير شايفة من الشمس, مش عارفة إذا شايفين. دكتور جورج أعطانا مثلا he's a cardiologist, فأعطانا tips على cardiovascular diseases and how to avoid them and what are the early symptoms إنه أنت عندك يمكن مشاكل بالقلب. These are still ongoing. We're reaching out to doctors and asking them to give us tips, and we're posting them. يلا دار. Okay, lastly, so many projects. طبعاً we still have so many projects in plan. However, so many of them got cancelled because of Corona. For the time being, we will resume them. The plan is to reach out بالawareness sessions اللي عملناها إحنا. We reach out to corporate companies. The idea كانت إنه إحنا كمان نوصل للpublic والprivate schools and give the best use of medicine to the teachers so that they educate the students and the kids early on. Hopefully when the schools are back, we will do that. We will do this campaign for the schools. We will be targeting schools. كمان there's an idea we would like to construct a medical center in Sahab area. Kaman, the idea is basically to help the people who are in need of help and they can't get all the services that they need. But still, this is we're working on getting the management approval on that. واخر إشي لسه عم نعمل free medical days. عملنا وحده بالمصنع بالمتحده. We will do more and more on that. This is it. Thank you. Right on time, Lara. Thank you so much for listening.
مركزين على سحاب، إذا عشان المصنع بسحاب؟
يعني احنا بسحاب مصانعنا كلها والcommunity in سحاب is helping a lot the company. We want to give back to them. بس we are also doing medical days, free medical days بمحلات مش بس بسحاب. It's happening elsewhere.
طيب بسحاب المجتمع المحلي عم بتقبل وعم يعني بيجي عندكم لما تعملوا أي شيء بيستفيدوا منه؟
Yes, yeah, we do. I think there is a picture, if I'm not mistaken. I can't go back, but there was a picture on a free medical day that we did in Sahab, and there were so many people who came, and we give out medical samples وهيك for people in need.
بعيد عن الميديكال ايشوز، توظفوا حدا من سحاب بالمصانع عندكم؟ يعني كثير من المجتمع المحلي بتساعدوهم.
Of course, we don't only help. We help بالطريقة اللي احنا بنعملها, but we help them in other ways. It's هيك الحياة يعني. So it's هي بس just because that's how much they're helping us, we would like to give back to them. Yes.
سؤال من عندي، قديش هاي الأمور اللي عم بتسووها are company policy, company يعني الماركتينج اللي عم بتعملوها I presume this is part of the marketing team ولا this is part of the initiative تاعتكم؟ يعني how much is it based on where the company is going ولا it's actually tied to your initiative اللي انتم عم بتسووها؟
So basically هلا احنا we are a pharmaceutical company. So at the end of the day, what's your vision? What do you want? What's your priority? It's patient care and the health and the safety of the patient. Some of these campaigns were there before. كل الجلوبال we do the global diggers وكلها يعني قبل كل هاي اللي احنا الانيشيتيفز اللي نقيناها. Best use of medicine it's been there for like years حتى before I joined, to be honest with you, the company. Free medical days اللي بنعملها بسحاب it's been there for years since we started our facilities there in سحاب. هلا الويبينارز والاwareness posts والاwareness videos, to be honest احنا كنا كتيم قعدنا we brainstormed ideas on how we can further work on that. At the end of the day we are helping the يعني it's احنا why we chose goal number 3 because it reflects who we are and it reflects where we come from. So it is part of marketing for the company as well. But no, it was our ideas that we actually discussed and suggested on the department, the concerned department اللي احنا لازم نحكي معاها لأنه هم there at the end of the day they get us the approvals they helped us in some of the things that we needed their help with it. We did that. وإن شاء الله حتى لو احنا خلصنا هدول الانيشيتيفز will not stop يعني we will continue on doing them for sure. Thank you.
عندي سؤال. So basically الانفولفمنت تاعتكم انتو كانت اكثر بالاونلاين ويبينارز وبهدول لانه من قبل كان في اشياء اوريدي مبلشه من الشركه. بدي اسال مين اكثر ناس بتحسوهم بيحضروا they attend هدول الايفنتس اللي عم تعملوهم اونلاين؟
ناس من برا ولا ناس من جوا الشركه؟
من برا الشركه.
هبه
في عندكم نوع من انواع المعلومات او احصائيات او اي شيء؟
سوري الاونلاين اللي هو الفيرتشوال ميديكال كلينكس اللي عملناها كانت من عامه الشعب يعني احنا ما بناخذ ديتيلز اكثر كمان مشان خصوصيه المرضى
اكيد
غير اسمائهم يعني.
بس كيف تعلنوا عنها مثلا؟
through our social media في through MS Pharma online يعني social media platforms وورد اوف ماوث يعني، بس هي بالاخر كانت اونلاين لينك يعني. في ناس اهاليهم يعني اللي جوا الشركه حضروا، اللي بيراجعوا مثلا اخصائيين غدد صماء مثلا حضروا وقت ما حطينا عياده خاصه للغدد الصماء وهيك. فيعني ما في كاتيجوري معينه يعني all kinds of people يعني whoever needed this كان موجود. يعني اللي حضر مثلا اليوم الصحي بخصوص الامراض الصدريه هو كان مريض عنده امراض صدريه ازمه وات ايفر. فما بعرف اذا هيك جاوبتك على هذا السؤال، بس the community basically يعني.
تمام. ثانك يو.
ثانك يو.
انا عندي سؤال على اليونيفورم، شو اخباره؟
اليونيفورم, so basically I'm sorry I'm not putting on my uniform today, but since Hiba's standing here, so basically again حاطين what's our goal, what does it represent, good health and well-being. عملناها with a local company عشان نشجع الصناعة المحلية. وهون heartbeat again it reflects where we come from, what's our goal. شركة أدوية لقينا اسم gold diggers we're digging for goals, I guess.
إنه something fun يعني مش هيك.
Yeah. With a female sign for women empowerment. It's يعني not don't know. That's what we suggested and that's what we all agreed on. So we went ahead with it. Yeah.
أكيد. Yeah.
Yeah. So yeah, أول ما بلشنا we started training تقريبا on weekly basis. It was on weekly basis for 2.5 hours. وكنا بنروح every Saturday. To be very honest with you كنا شوي بنات أكتر, بس هذا الحكي maybe a year and a half ago. So some things happened. Some people unfortunately had to leave the company. فاحنا بلشنا التدريب على اساس انه كان السكجول اوف ذا تايمينج فور ذا ماتشز كانت ماشيه زي ما كان المفروض تمشي. كثير من البنات, ما ححكي كثير لانه احنا عندنا مرام هون شيز اميزنج, بتعرف تلعب كثير شاطره, بس تقريبا يعني اكثر من 70% ما عملنا لعبنا فوتبول. فبلشنا from like zero وكان معنا coach all the way and we really ourselves saw a progress in ourselves. يعني ما كنا بنحتاج حدا يحكي لنا انه انتم عم تعملوا كثير منيح, لانه احنا كنا شايفين حالنا قد ايه with time we were progressing. Unfortunately corona happened and pandemic happens and some things changed. البنات اللي كانوا معنا من الاول كانوا عم بيتدربوا, they became better, they left the company. فضلينا احنا we are very consistent and insisting on staying and we do believe that we are only us. في بنت كمان معانا بس unfortunately couldn't be here with us today. We will be able to do it إن شاء الله. إن شاء الله.
Thank you.